Los Angeles Public Library, Department of Rec and Parks, ITA, Information Technology Agency, Bureau of Sanitation, the Police Department, and the Fire Department to report on how to improve city interactions with individuals experiencing homelessness. Back in April, the CAO outlined a variety of interactions with the homeless populations that accounted for at least $100 million a year, separate and apart from any money actually intended to serve people who are homeless. Most of this 100 million, 87 of it, in fact, was with law enforcement interactions. While departments don't generally track interactions specific to the homeless population, we do have some rough data, and we know that about 15% of arrests by the Los Angeles Police Department are homeless people. At least 7% of the fire department ambulance transports are for people who are homeless. One of our goals in the strategic plan is to improve the incidental interactions the city has with the homeless, so as to better connect those interactions to ways that provide services and housing that get people off the street. The term, quote, "no wrong door," is used to describe a coordinated system where an individual can be immediately linked to supportive services regardless of their point of entry into that system. In city terms, this means each department that interacts with homeless people would be similarly equipped to connect homeless individuals to the services they need. The county-led policy summits of the Homelessness Initiative are also examining the coordination, training, and databases needed to achieve the no wrong door policies. Some of the recommendations that came out of our report in April, which today's session we'll hear from folks who are actually engaged in the work. They can underscore these, that we needed to designate an office or a department to monitor adherence to a policy, develop tracking mechanisms to measure the city's actions and expenditures related to homelessness, and report to the mayor and council on progress at least twice a year. Instruct the CAO to work with city departments to change responses across departments to homelessness, to include systematic connections to outreach and services when appropriate, and periodically report to the mayor, and instruct departments to implement changes in processes for interacting with homeless as they are developed, and periodically report to the mayor and council. So we'll have a number of presenters. We'll ask them to come up one by one, and we've got a good amount of presenters today. So I'm asking my policy director, Rachel Brazier, who's back here in the green dress. She is the timekeeper, and it's her birthday today, so you have to be nice to her. And so she's going to help us with time to make sure we can get through all the departments in the time that we have for the meeting. Do we need to read an item into the record, Mr. Clerk? Thank you.
Item number 1 is an item that was continued from June 18, 2015. It's a CAO report relative to the city's engagement with homelessness and the budgetary impact to the city. And the Library, Recreation and Parks, ITA, Bureau of Sanitation, LAPD, and Lafd to report on how to improve city interactions with individuals experiencing homelessness.
Thank you. So our first presenter will be from Los Angeles Public Library, Madeline Rackley. If you could come up to the table, dear team. And she is joined by Cheryl Collins, the Director of Branch Library Services. Over 90% of our libraries, I thought it would be higher than that, have regular patrons who are homeless. There are between 700 and 800 homeless patrons every day in our libraries. Library staff report that complaints and violence incidences regarding homeless patrons has increased. The Central Branch librarians have provided homeless health care referral training, and resource desks for service providers such as health care, veteran care have been established at some branches. We have at least 11 locations where LASA ERTs are regularly scheduled. If more ERTs were available, it's my understanding you all could make use of those. So I'll let you talk about the balance of the findings that you've made regarding this issue.
I'd just sort of like to give you some background about the library and how we interact with our homeless provides vital services to all our residents. And while we don't distinguish between, we don't ask people about about their status. We do provide vital services. Our main business is providing reference and referrals, which through approaches, get a lot of new homeless people coming in. They're looking for shelters. They're looking for places to find medical assistance, assistance for getting benefits, and we are more than happy to provide information. We sometimes have trouble getting up-to-date information, and we're always are valid and right and up-to-date. We offer a lot of services that I think are attractive to our homeless population. Mentioned in the report, we talked about our Veterans Resource Centers. We have 11 of those throughout the city. They're staffed by AmeriCorps volunteers, and they are particularly interested in getting veterans housed. They offer vouchers and get them signed up for benefits. We're in partnership with the Weingart Center, which has a long history in providing services to the homeless. We're also working, as you said, with LASA and with the Department of Mental Health. I should say that most of our homeless patrons use the library in the way that it was intended to use. There is no problem with them. We're more than happy to serve them. We're proud that we have a service that is appreciated. Mental illness, untreated medical problems, untreated substance in the report. So we're working with the Department of Mental Health not only to do of what problems are, what services are available, and as a matter of fact, we've had our first staff training with the Department of Mental Health yesterday at our central library. We also offer a lot of programs. We have a program called Health Matters, which offers not only classes about health, but free flu shots, free eyeglasses, and other types of health screening for diabetes, high blood pressure, a number of things that are very popular. We also provide outreach services to Skid Row. We offer a number of educational programs, both online and classroom style. And we're also proud of our connectiveness. People don't have access to the internet, but we provide at all our locations. We have over 2,500 internet-connected computers that are free for people to use. And we also have a lot of workforce development. As a matter of fact, we have a workforce development portal at our central library and more in development. The problem is growing, especially, as I said, with people on how we can better serve that population. So I can help to answer any questions you have, anything specific about any specific branch.
Members, any questions?
Thank you. So you guys do a great job, and I love libraries, and I think that important and sufficient, but it's not homeless work, right? So that's not why you went to library school, to be a person who's going to be interfacing with homeless people per se. And I appreciate that you say that you take all customers as such. What part of your budget would you say gets spent, though, on interfacing with the homeless, referrals, dealing with security concerns, a whole range of things? What percent of that would you think?
So they say we don't classify people. I mean, you can't judge a person if they're homeless when they walk in or not. Our main business is referrals, so we refer people regularly. That is part of our budget. The majority of our security issues are not homeless related, I don't think. So it's hard to say. I don't know if
I would have to get back to you on that, on the percentage of our budget. We don't ask,
right.
So it's hard to track it right now. But I'd be happy to find out if we do have any information, report back to you.
Look, there's new reports. I think we're number one on homelessness now. I think there's a new report today.
yes.
And so it's important for us to be able to measure what our commitment is and what we are spending. And so to the extent that you could do that, that would be helpful, because we need to measure where we're at and see what we're doing and where we're putting our money. And that helps us figure that out. So if we could figure out those, those costs, like I said, there's certain activity, and I don't know, I mean, like you said, you're a referral business, so you do referrals, you refer everybody. But any other concerns you might note? Sleepovers, additional costs on the restrooms, security, I don't know. But it seems, for example, at the Central Library, I live nearby, that there's a high utility there. And so if there's any way to...
We've just begun this conversation since I've been at the library. Again, I'm new, so I need to find out what we're doing and how we could.
Mr. Dio? I'm sorry, Mr. Price.
I too am a fan of the libraries. My positive learning experiences were at the Vermont Square, and so I grew up right around there, went to Normandy Avenue at the library. And you're right, it's a tremendous resource. I know it's primarily referral, but as you mentioned, you have a lot of information that's good for individuals to know about and to use. And for those who come in, that's great. Any outreach efforts, though, how do you kind of plug in either with other community organizations or groups that are in the field, in the community, and you can sort of add the fact that, hey, also information is available at your local library for those who may not be aware and who, indeed may need some information that you have.
We're always reaching out to our community. Matter of fact, we have librarians that specialize just in outreach to the community to make sure that we're tuned in to what our residents want. We are active participants in our neighborhood councils. We work with a lot of our nonprofit organizations on our various initiatives. We work with local hospitals and clinics to provide health services at our branches, flyers and workshops.
And I know, and you do a great job at that. I'm just suggesting some additional outreach efforts to the homeless community.
Not
absolutely. To the community generally, but to those populations that we're trying to address and serve. And I know everyone may not be interested in getting a flyer for what's available, but to what extent are you in the shelters, or how do you connect with individuals, letting them know that in fact this is another resource that's available for them?
I should also say that our relationship has become closer over the last year or so. They do outreach, as Councilman mentioned, to really do want to expand and get out to some of the other areas that we know.
Because these libraries are a safe haven. You got grass, you got trees, you got bushes, you got places where people camp out. And so, thank you.
Thank you.
Thank you, Councilmember Price. Councilmember Bonin.
Thank you. Just a quick question, I think. When the CAO's report came out earlier this year and said $100 million, there was an impression that this was $100 million of reprogrammable money. It may not have been the CAO. It was certainly perceived that way by many policymakers, by the public for sure, that this was $100 million programmed into housing or shelter or homeless services. My question for each department today is going to be, to what extent is any of it reprogrammable? My sense is, if I recall correctly, that the department's budget is largely set by law, by ballot measure, and it's not money that we could be reprogramming into some other department, right?
That is correct. The library's budget is funded entirely, programmed into other library activities.
To buy more books, essentially.
Right.
Or more services. Okay.
Right.
I just wanted to get clarity on that, because I think a big part of what we're trying to do is figure out how we're currently interacting with our unhoused residents, but a big part of it is trying to figure out how we can reprogram money, and I just wanted to be clear anything else.
Right.
Let me just say then to thank the library department for the work they do. Libraries in my district, particularly the Abbott Kinney Branch Memorial Library in Venice, spends.
Excellent. Thank you all so much. I've gotten the time signal, so I will thank the folks from the Los Angeles Public Libraries, and I will call up our team from Rec and Parks, or Recreation and Parks. We have the captain of the park rangers and the superintendent of operations.
Good afternoon, Councilman. Joe Solisis, Superintendent of the Department of Recreation and Parks. And Chief Torres of our Ranger Division, who oversees our ranger operations. The Department of Encampments. The Park Ranger Unit currently has 2 full-time employees and 2 half-time employees dedicated to covering the entire area. The SIP sources through our park rangers is not enough to cover that. The department is in the middle of expansion of the park ranger division and to get them the proper shelter and assistance that they need. Currently, the department is building from a staff of 23 rangers to an optimum amount. Another part of that would be to offer a post-training for officer standard training for homeless encampments. This is currently being received in the county, and currently the department is looking into adding that training program for our rangers so that they have a more better toolkit to deal with the homeless encampments throughout the park. Improving communication with outside agencies and nonprofits through a one-stop shop that would track homeless whenever contact is made, will help develop relationships, knowing them when we're at the point of having to clear out an encampment. Maintenance crews come and assist work. The Department of Recreation and Parks is unique in that we have a municipal code that prevents people from being in the park after a certain hour. So it's a little different than what we're experiencing out on the street. But again, we want to take a very holistic view at this. Chief Ranger Torres would be happy to comment on anything about the direct interaction.
I would just like to say that our department is moving more toward, and the birthplace for the type of work that I do was at MacArthur Park in 1980. Encounters become much improved. We are generally very successful.
Thank you. Questions, Mr. Cedillo? Big one.
So you have the ranger cost for us. So much of your work then would be direct encounters with homeless people with encampments, MacArthur Park, and then the Royal Seco. Much of your work is just that, right? Just the homelessness?
Well, at the moment, we don't have exact numbers, but we think it's somewhere between 7 and 10% of our rating expanded on homeless encampments.
That's it? 10%?
I think it's more.
Well,
15 minutes a day or 30 minutes a day? That's it?
Our team
No.
is present today. The County Mental Health, LAPD, and a number of priorities as they come. Currently, we're very intuitive, and we're able to move. Medical issue of time, distance, and worst of all.
I mean, that portion is the part that we're able to resource right now, but it's nowhere near the amount that we need.
So let me ask you this. We have a concept. I think Councilmember Bonin and I and others are willing to look at, set aside these things called park zones?
Safe parking.
Yeah, safe parking, right? We want to take parking lots that maybe are at the parks and put some RVs there. I've got started with 2 to 3, now that's grown to 10 on Figueroa in front of Sycamore, down maybe to Ramona Hall, maybe down the street. Is this the work that you guys would be interested in? Because we're going to need security. Who will make sure that these are safe parking areas and not anything else more than that. Is this work that you guys would be capable of doing and be interested in doing?
Well, we would have to look at the resources that we need, and we'd also have to look at the type of work being required to do. I don't think I could answer that question today, but I would certainly be interested in looking into it.
We were presented with an option because we're going to need housing quickly. Someone presented us with, what are they called, the containers?
The containers.
Cargo
Recycled,
containers,
yeah.
right, that can be adapted to become housing. Of course, he would need hookups, restrooms, maybe in the units, maybe not. But what's the capacity of the parks to do that? What's our acreage? And what are your thoughts on that?
Well, we'd have to go and do an evaluation of how many parking spots that we have that may become available for that type of assistance. I don't know. I mean, I can tell you that there's 16,000 acres of open space in the parks. Of course, that's not all parking lots. So we could certainly identify some areas that we may consider
16,000 acres
of open space. Yeah, that's not all.
What's the biggest? Is that Griffith Park?
Griffith Park at 4,300 acres.
And then close to 600.
Keep in mind that this acreage is mountainous terrain.
Mr. Price? Bonin? all so much.
Thank you.
We will now ask, yeah, good job on the timekeeping. From ITA 311, Jennifer Banos and Donna Areccia.
I'm the 311 director responsible for the 311 call center. What the types of calls that we get are typically for service authority, and also 211 is we refer a lot. I don't think it's really good practice for us to be getting the call and then referring them to services. Of course, if they're needing help, immediate help that's related. One area that was brought to my attention by my staff was, in particularly recently, we've started to get more calls from homeless because they're being priced out of rentals and the cost, you don't have money for that. So we try to give that out, but that, I think, is a growing.
Excellent, thank you. Questions, members? Mr. Price?
Presentation. So what are you doing in response to this onslaught of additional calls that you get?
Mr. Cedillo?
Same question, right?
Yeah.
What percentage, what amount would be of your budget would be on the homeless?
About 125,000 calls per month. It's really very minimal.
That's minuscule. We've got.
It is. I believe that many of the maybe chronic homeless, they're more familiar with the services already. 211 directly. I know they get a lot more calls for that type of activity. Like I said, if I can gather more information and establish a business.
How much did that cost?
It's. I think I've got about, but maintaining that, it's probably no more than.
Question.
I don't think it's a matter of staffing. I think at this point it's just a matter of get information from them more proactively, and be made aware of it so that we can enhance our database with better information.
For overseeing my LA 311 implementations, the system that Donna's referring to is our knowledge base, where we list all of the city services citywide, not just homeless encampment or homeless related services. So one area that we would like to improve, and this committee can also help, is to encourage additional information. Who are providing services update the information in that database so that it will be easily.
Excellent. Thank you all. Next, we'll call up the mighty Los Angeles Fire Department. We have Chief Tim Kelly with us today. Welcome.
Thank you. Good afternoon. Tim Kelly. I'm a new face over across the street, so let me introduce myself. I'm working in the emergency operations as the executive officer for Chief Rueda. I've been on the job 29 years, have worked throughout the city. In talking with the homeless and the poverty issues, I think that that's really an issue that impacts all of us, either on a personal level or professional level, and in some cases both. The fire department has been working really aggressively towards our role in addressing the homelessness within the city. So the innovation that the department has really been working on, with really the mayor's emphasis on innovation, looking at all departments and how we can be better equipped, more efficient, more effective with the resources we have. So when we're talking about the homelessness issue, really the question that the fire department has been asking itself is really, other than the traditional role with what we do in terms of responding to providing medical and fire services, is we deal with homeless population. So the question is really, other than the traditional role of responding and providing care, what's the fire department's role in really the outreach and engagement piece of it? And I think that really requires innovation, because the idea is to really help these people in getting them really into this engagement or services, which situation they're in. So in terms of the fire department, it takes a lot of creativity and innovation and thinking, so we have a lot of people working on that. I think the the ability to be innovative. One really good example of that is the fire chief's reorganization of the fire department. I think that's really a good example of how the fire department is constantly or consistently looking for ways to really maximize what we have and always look to improve our service and address the needs. That's constantly evolving. So in addition to my role as executive officer in emergency ops, I've been tasked with or given the title of homeless coordinator. I'm not the only one working on that. I recognize in that role and with the time that I've been spending on this that it really will take a concerted effort and really find a way to get everybody involved addressing this issue. I have been sitting on the county initiative, the policy summits, where we're actually working on some policy strategies to address this from a county and a citywide level. What's interesting to me is I think everybody recognizes that it really is going to take a collaborative effort with the efforts to really coordinate all the services and the programs is important so we don't duplicate and overlap efforts. And so that, my role there, and like I said, we've been talking about some of the things that really directly impact the fire department that have come out of that are the recognition that public or first responders, whether it's fire, police, any first responder, they're looking at county-wide training protocols for first responders in these engagement and outreach efforts from a public safety standpoint. The fire department data for LAFD, we routinely respond a day. Some of the numbers I have in terms of what that translates into the homeless population. In terms of EMS, it's about 5%. The data I have is not most current. I have some data back to 2013-14. But the initiatives that the fire department has really been, I'll just highlight a couple of the innovative programs that the fire department has just undertaken. As you may be aware, the first one is the fast response vehicle. It's currently a trial program, a 6-month trial program. We have one that is operating in the downtown area in Battalion 1 and Battalion 11. And then we just put one into service out in the northeast end of the San Fernando Valley out in Battalion 12 area. So the fast response vehicle is staffed by 2 firefighter paramedics. It's essentially a mobile intensive care unit, an ALS assessment resource. They're running on a 4-10 schedule, 4 days a week, 10 hours a day during peak service times. And essentially the goals of the fast response vehicle, let me just tell you that in addition to the medical services it provides, it's actually a dual function vehicle. It's a brush patrol type vehicle, squad looking type vehicle. It has a pump on it, hose. So it does have the capability to perform fire suppression activities. But essentially the goal of the fast response vehicle is to respond to EMS incidents to decrease response time, initiate faster patient care for time-critical patients, perform on-scene triage, and cancel responding resources as indicated to increase operational efficiencies, increase availability of both fire companies and paramedic ambulance, respond to incidents when a basic life support company on scene requests ALS or advanced life support resources for against medical advice, paperwork, and then provide EMS resource coverage. So I think those goals speak for themselves. The fire department's tracking data on that. So far, the fire chief and the administrative staff are very pleased with the results on that. But essentially, the maximizing with this resource, we're allowing that resource to get on scene faster, potentially free up fire companies that are responding to medical calls. So leaving those resources, fire resources, available for additional fire calls or other medical calls. The other initiative that the fire department has embarked on is the nurse practitioner unit. The fire department is going to roll that out in a press conference on November 25th. with a target date of implementing that at the 1st of December. And essentially, the nurse practitioner unit is a licensed nurse practitioner teamed up with a LAFD paramedic, and it's really to address what we've identified in the fire department as EMS super users. Those are people that are routinely calling the fire department for possibly low acuity EMS issues, but with the nurse practitioner and the LAFD paramedic, it's really designed to go after preventative care, direct them to appropriate health care without the transporting to hospitals and then having resources sit in hospitals waiting to be triaged and then ambulance. One other concept and innovative idea that the fire department is looking at is an Lfd Sober Unit. The concept in a conceptual phase at this point would be a sobering center with Lfd Sober Unit attached to that, working with social workers, or idea of treating chronic inebriates at that, providing them with the services and long-term care that they need there. That design is really, again, to maximize what we're doing with our resources, free up our resources for more critical type calls. And then really, like I said, the emphasis is really the fire department's role and what our contributions are to the mayor and the council's efforts to really address the homelessness in the city and in a larger aspect, the county. So with that, I'd like to open it up.
Well, that's very exciting. It's actually great to hear some new thoughts on how we address this. A day, that's incredible.
Did I say 15,000?
12 to 15,000.
I'm sorry, I meant 1,500. I apologize.
Okay. Just drop a zero there.
Yes.
That's still a lot.
It is.
So this is interesting. Nurse practitioners, how many, where we're going to get them from, who's helping us pull this group together? We're going to pull them out of clinics, out of hospitals, out of UCLA, out of USC. Where is the pull? What's the number?
Yeah, so the nurse practitioner, the pilot program, it'll be a year pilot program. It's funded by the Mayor's Innovation Fund. We'll be staffed with a nurse practitioner, a licensed nurse practitioner, and a licensed or fired LAFD paramedic. And the service area for this first unit is going to be down in operating hours will be similar to what the fast response vehicle is doing.
Give me the time on that.
Say again? It's a 4 days, 10-hour days.
Like 8 till 6?
Yeah, 8 till 6 o'clock.
Aren't more encounters, wouldn't they be more in the evening, or a need in the evening?
I believe the Battalion 13 area that consistently, those are some of our highest call loads down there in addition to area here. So yeah, they're routinely our calls after those hours, but much like the fast response vehicle, although that has a little bit different time frame on that. And that's also something that we'll evaluate in that period. Is that the most effective time frame for that unit that's working down there? But our fast response vehicles are working from about 11 o'clock to 9 o'clock at night in this.
Talking one? We're talking 10?
One right now, sir.
One?
Yes.
So how do we ramp up? We're going to look at a pilot first and then figure out after. It seems that given that we're now the #1 homeless city in the country, nurse practitioner.
Right. So while the nurse practitioner unit is will have some interaction with homeless, it's primarily it's a resource that won't be dispatched. There's no algorithm for that resource. It'll be really identified with citizens or people that are in the system that are routine with homeless. Some of our data, it may be underestimated with what we actually have, because that are unconscious and we don't have identification, so we can't really identify them being actually have more numbers. This particular unit, the nurse practitioner unit, the two goals are to decrease the rate of the 9/11 utilization by EMS super users. We'll work with the identified EMS super users in order to perform comprehensive at appropriate clinics. The second is to decrease the number of ambulance transports. NPRU will respond to selected low acuity EMS incidents and patient assessment with the goal of accomplishing a treat and release, treat and refer patients, thereby eliminating the need for ambulance transport. So those are people that we've identified or that are chronic or super users. Although, like I said, we do have a number of calls that do go to homeless encampments, populations in the city routinely. So that may be something that, in addition to the nurse practitioner and the education and our efforts towards reducing homelessness, is, as I discussed, training for the fire department and our objectives and what we're doing to engage homeless people with the right services. So
I would like to see, obviously those services in the 1st District. MacArthur Park comes to mind, the Pico Union area, Northeast Corridor, the Royal Seco, certain areas where I think we could have use for a nurse practitioner. But it just seems to me, and I don't want to speak, I know the councilman's not available today, but it just seems to me that Skid Row might be a place where we could use a cadre of nurse practitioners to intervene in or wherever. Where do people go when they're picked up on EMTs out of Skid Row?
Excuse me?
When you deal with people on Skid Row and you're going to take them to an emergency room, are you going to LA County? You're going to California Hospital?
Yeah, I mean, it's various, but typically it's dependent on the medical condition and what resource is It's mostly the most accessible receiving unit or the closest.
And so for Skid Row?
That would be California. They could go to county.
Okay. Seldom Good Sam?
Good Sam, yeah, that's...
Just seems that might be a place, given the concentration of homelessness and the both chronic and acute in terms of pilots, look at it at an area.
Yeah, so the fast response vehicle... I'm sorry, sir.
I just want to make sure I'm not taking away from Mr. Price's area here as augmenting the pilot in Mr. Price's area.
So yeah, the nurse practitioner will be watching that closely and evaluating the data. The fast response vehicle in downtown is actually servicing Battalion 11, which is the MacArthur Park area also.
So talk to us about the costs on that. How much of a cost is that? Percentage of cost? I mean, I like this program. It seems that there's taking people to an ER and having a couple of your men or women.
Are we talking just in relation to the homeless?
Yes.
Yeah, so I think, like I said, the innovation that the fire department has started with here is really a really good approach and a first step to what we have. The funding obviously is always factors into that. The nurse practitioner, the cost of that is the fund was $245,000, 1-year pilot program. I don't have the cost on the FRV. The vehicle was, like I said, it's a dual function vehicle, services as or functions as a fire suppression resource as well. It was a brush patrol that was converted to this medical. So we have it staffed with our tactical EMS people from that are working on. I don't have the direct cost related to that, but I can follow up on that.
I don't want to get into micromanaging, but is there really that? I got just 2 more questions here. Mr. Chair, I just have this incredible sense that LAFD might be a more appropriate agency to interface with the homeless rather than LAP, given their mission, given their focus, given their training. But it doesn't seem that we're putting the resources there. I'm intrigued. I like this nurse practitioner program. I think that makes sense. And I'm not sure, though, that we need kind of dual function vehicles unless you tell me that there are fires in tents or fires in small units down in Skid Row. I'm not quite sure.
Well, they could respond to that. They could respond to rubbish fires, and then we have vegetation that outlines the freeways and all that. So, but let me just go back to, I think, like I said, the fire department. In addition to these innovative programs, we're looking at really our larger role and really force multiplying our resources and our people, and really training them about how, when we do make contact with the homeless, how do we engage them other than just treating and transporting them, really helping them get out of the homeless situation and into housing and care and that. So that really is a big part of what the fire department's doing, in addition to really looking if it gains there. That will definitely help and maximize the resources that we have. That would really eliminate costs. So I think, like I said, it's really, there's so many services and resources out there, public and private, and I think a big part of it is going to be educating the fire department on, and really coming up with some standard protocols about how and where we refer people, because we do go on them every single day, people, and a lot of times all we're doing is treating and transporting to the hospital. Medical condition, they're sitting in the hospital for extended period of times, or ambulance are sitting there because we haven't transferred care, and so that increases the amount of out-of-service time for our rescues. So, like I said, I think that it's really an issue that if we can get at the preventative aspect of it, and fire department, that's what we're really looking at. Our role is what is our engagement objectives, or what are those objectives? And I think it's really simple. I think it's really understanding the resources that are out there, having a standardized referral process for take them out of the homeless. In terms of the encampments in the riverbed, with my colleagues here, the stakeholders in that, the fire department and LAPD has been working in anticipation of El Nino, how we're going to respond to and really prevent our loss of life in the river and the channels, because we have a large number of homeless encampments there. So we have developed response protocols in conjunction with LAPD. We're getting in the process of rolling those out to our administrative staff in terms of briefing and oversight on that. But the piece that was missing in that, because I've been sitting there, is that it's really a warning system, and getting in there, and again, that's responding. So my input into that meeting was since we're in the rivers and we're going to be talking to people, we need to pull in all the resources that are really trying to help the homeless out of the homeless permanently. So that's a perfect opportunity. When we're in there warning people, we should really be teamed up with PATH or the Homeless Services Authority in really referring these people and seeing if that outreach at that point, and we can do something there, because that's a chronic cycle too. We have people there every time it rains. Fire department responds, and we're doing swift water rescues at those sites.
You know, Mr. Chair, I don't want to be the ball hog here, so I think if you're available, maybe we could have a follow-up meeting in my office. I'm really interested in these innovative programs, learning more about the Sober Unit, and have a sense, an intuitive sense that perhaps more nurse practitioners and more LAFD personnel might help us in both preparing for El Nino and preparing to move people off the street. Thank you.
Thank you, Mr. Cedillo. Mr. Price?
I, too, just want to congratulate you on the spirit of innovation that it sounds like the department is taking on this issue, and certainly recognizing the fact that you got to be collaborative, and it's not just enough, like I say, to pick up. Talk a little bit about, you mentioned, let me back up. On the average, how many time do you end up transporting an individual someplace? Is the usual MO that you get to the scene and you're going to take them someplace?
2013-14, we transported, or LAFD, 356,766 EMS incident. 4.7% of those were recorded with inpatients. I figured that to be about 16,768 calls. Of these, 211,000 roughly resulted in transports, of which, so let me back up, 356,211 resulted in transports, of which 6.6% of those were homeless. So out of the 356,000 in 2013-14, about 17,000 were homeless, and about right there. That's 2013.
And transport, because that was the protocol, right? I mean, you go there, you take them as opposed to treating on site.
Yeah, essentially the fire department, on every call that we go on, transportation is offered. If they're refusing against medical advice, that's one of the functions of the fast response vehicle. That typically requires that normally would tie up a resource like an engine company that was on that call. If it had a paramedic there, this fast response vehicle could serve as that function, freeing up the resources. But
so it just really expedites transportation, not really treatment. This rapid response.
Well, it does both. So their main focus, the FRV, is our immediate dispatch. It's 20 categories, but basically full arrest or cardiac arrest, seizures, distress. We have a dispatch algorithm now. It's called immediate dispatch. Our dispatchers alerts in the fire station that's an immediate dispatch under that algorithm. So their focus of fast response vehicle is really focused in on those types of calls first, and they're patrolling the Battalion 1, which is downtown, and then also Battalion 11 downtown there.
And you mentioned a patrol pilot effort in South Bureau.
Yeah, that's
South
the nurse practitioner unit. Yes, that's in Battalion 13.
Cover?
That's in CD8, Mr. Price.
Yeah, those 8 only?
South LA, so all of Battalion 13, which is the South LA area right before you get down to San Pedro.
Anything else? Thank you, Mr. Price. Mr. Bonnet.
Thank you. Several questions for you, and we're way over Rachel's quickly. First of all, before I get into mention of the nurse practitioner that you were talking about, the department doesn't in any way routinely care or not a call or a transport is for someone who's homeless or not, right?
Well, if we can determine that, it is put in our electronic patient care record.
Okay.
So that would go in there.
Okay. So then,
based on that data that's going in as a trend
in one area, is as we expand that, we should be expanding where the data shows us the hotspots are. I'm glad you're participating in the county summits, and I was interested that you had picked up from those part of that. But I didn't hear you mention, and I got distracted for a minute, so maybe I missed it. But I've heard a lot of talk about service referrals. The county has a way of nurse, and I've been talking since May at the latest about the city of LA and our paramedics, or the hospitals that we bring folks to, can be portals into this program. Are you aware of any conversations that LAFD has been brought into the loop about doing that?
I have not. So I've sat in the last two policy summits, and the coordinated entry system, I think, is really right now. So
no, I know the coordinated entry system's great, but it's a database. I'm talking about a way to get folks into housing.
Yeah, but in terms of that, no, sir.
So you're the homeless coordinator for the department.
Yes, sir.
You haven't heard any discussion.
Point, no.
Okay. CAO, who's sitting here, when you come up, this is something I'm going to be asking about, because I've been asking about this since May, honestly, and it's housed. And if we haven't been pursuing it, it's really frustrating, because the county can actually get people, chronically homeless people, housed rather quickly. There's a number of different groups, and from those hot lists, they then house the folks who are at the top of those lists. Where are we LAFD.
Yeah, that's ongoing discussions at this point. That is something that I believe, and I think recognizes, is that if we can share the information, that's really a key element. So the HIPAA or potential violation is really the concern for us. So that's, I know the medical director has been working on that, and that's we're in discussions on that. So,
and I'd like to get an update on that.
Certainly.
It's I know there's been conversations going. My office has been engaged with them, city attorneys, and I'm baffled about why it remains one. You mentioned, and this is my final question. You mentioned the units that can be used right now. An incredibly perilous problem, where we had 2 fires just in the past 2 weeks, and were it not for the wind, and we had a 3rd brush fire set by an encampment in November of 2010. Are any of those units that you were talking about deployed in the west side in the brush areas?
No. So the FRV 401 is out in 91's district, northeast end of the San Fernando Valley, and then 201. The idea is to put one of those in each bureau. The status of that and the projected time frame on that. Those 2 vehicles were purchased from our MICLA fund. They were converted to the fast implementation. I know that is coming to have one of those in each bureau.
Do you have a sense of a timeline on that?
I don't at this point, Councilman, but
it's scary as hell.
Yeah, so again, I think as we move along the fire department, if we have contact with homeless, it's really going to be our outreach and engagement efforts to really hopefully solve that, and not just like move them out of an area and they come back. And that's typically what we see in the LA River. We will clear people out of the LA River, they come back, and typically it rains and we're off water rescue. Very technical rescues, high risk. If we can prevent that and avoid those, and really again move them out of those situations and into permanent solutions.
Thanks, Mr. Chairman.
Excellent. Thank you so much, Mr. Bond and the members. Thank you, Chief Kelly.
Yes, sir.
Appreciate you. We're excited about the nurse practitioner. It's one?
One.
We're excited about the nurse practitioner. I concur with my colleagues that a pilot would look much more like a dozen or so. But we'll follow up on that. And thank you.
Yes, sir. Thank you.
I want to, in the interest of catching up a little bit, and because during this week, these 2 departments have been the topic of much discussion amongst the members of the Los Angeles City Council, call together, if they will indulge me, a representative from our police department, Commander Bob Arcos, and a representative from the Bureau of Sanitation, Steve Patterson. Inasmuch as these 2 departments work together the most in terms of dealing with encampments and homeless folks, I thought it might be appropriate to see them together and to save a little bit of time. So, Commander Arcos, we'll start with you and then go to sanitation.
How's this? Can you hear me? Yeah. Okay, thank you and good afternoon. Just a really quick note before I get into the LAPD thing. I may answer one of the questions. I know you are all familiar with the innovation fund that was granted to Central Division through LASA with the ERT workers. And part of that program does involve us liaising with LAFD in Skid Row for super user folks in the area that we could track with the ERT workers. So that is going on, and I believe this committee did ask us to report back on that in 90 days or so. So
just on the super user, really quickly, I've heard really wild numbers, like in the dozens of calls to the same location for
Hundreds.
the same person.
Yeah.
Is that urban legend or is that real?
No,
real
it's
stuff?
factual, and I don't have it with me here, but we did use it in our presentation to for 2014. I believe we had 36 what we considered super users, and there were several of them that were close to 100 times for services. Yeah. And I know this committee has met me before and heard me before, but I want to make sure that I do clarify one thing. And when I speak, I often refer always to Skid Row in downtown because that's where I'm located. However, I represent the department as a homeless coordinator, and you all know there's serious problems in South LA, in the West Side, in the Valley. So they're all suffering similar issues that are going on in Skid Row. So for just my piece on catching up the committee on some of the things that are going on or could help assist LAPD, that the three top areas for us in dealing with the homeless conditions are revolve around mental health services, the substance and alcohol abuse services, and then storage. And when I say storage, I do mean both voluntary storage availability and involuntary storage availability for those times when there is enforcement being done to secure the excess property. The ISO program I just mentioned, just a really quick recap. In the last 3.5 weeks, we've had somewhere near 50 to 60 contacts with 10 placements with that, and that's a collaborative effort again with the ERT workers and LAPD. No confrontations. It's been very, very smooth and much beyond our expectations. You also know that what's coming soon is not an LAPD program, but it is a partnership with LASA, the C3 program, which will hopefully be a force multiplier already, what we're doing with the ERTs. Without getting back to the Department of Mental Health expansion, so there are two aspects of mental health that the officers are dealing with. So, we have the first responders for those who are in crisis. The 911 radio calls for the officers responding to crisis, and then subsequent to that, the SMART team responds to help deal with placement, whether it's going to be a 5150 hold. And that's an important aspect of what we deal with spontaneously in the field. But one of the bigger issues that would help support maybe reducing the number of services that LAPD has called for, and that aspect is more DMH teams on the street that are dealing with those in pre-crisis. They're not in crisis, but they may be in pre-crisis to help identify them soon and start working through some intervention programs or some case management in the street. That's one of the asks that we think would help us in reducing our level of service calls for LAPD. I think Chief Kelly hit it. A really important aspect that we would also love to see is high tolerance sober centers in these areas to help them detox, and then at the same time receive a level of outreach and engagement within these centers before they're released, and whether they decide to take it or not, at least there is an opportunity that's being presented. So high tolerance sobering centers, the expansion of mental health. I know Chief Beck is actively working right now with the department chiefs on expanding our SMART teams. We would like to get much broader coverage 24/7. These crises that are going on out there don't stop at 5 p.m. And that's one thing that we have to look at too with our ERTs, is expanding our hours and maybe adjusting our hours because they've been so successful. We need them all hours of the day. And I think Sanitation will speak on their ability to help us out on more coverage as well, which will be a big plus for us. Very quickly, the department still continues to move forward with this mental health intervention training, which is 36 hours for our officers. And we're also working currently on, once 5611 is finalized and approved, conducting citywide training for all the areas, so we have consistent application of 5611. I think that's just kind of a rehash from the LAPD. I'll leave some time for sanitation, and then I can answer questions if that's okay.
That's perfect.
Okay.
Good afternoon. My name is Steve Patterson, Bureau of Sanitation. I'm Chief Environmental Compliance Inspector. Bureau of Sanitation's primary contact with the homeless is when we perform our homeless encampment cleanups. These are regularly scheduled cleanups we do throughout the city. We usually send about 2 to 3 teams. In anticipation of these cleanups, we have coordinated with LASA that they would go out and do outreach prior to the cleanups to the homeless so that, first of all, the homeless are aware that the cleanups are coming, but second, also to provide services to the homeless. From what I understand from LASA, they do about 3 visits to an encampment prior to the day of the cleanup. When we do our cleanup, on the day of the cleanup, if the homeless are desiring services, we will give them literature or call LASA to get a representative out there. In addition, we also encounter homeless when we get reports of RV dumpings or leakings throughout the city. RVs, and these RVs are parked in the public right-of-way. The public will notify us that there's a discharge, and when we get out to the location, in addition to cleaning up the discharge, we will offer LASA's services. We'll call LASA or direct them to LASA. As I said, we perform these cleanups in the interest of the public health and safety. We are providing the homeless with a more cleaner environment, but we only have 2 teams. We would desire to add more teams, but that's a matter of resources. Our cleanups started with Operation Healthy Streets in May of 2012. We added the Venice Boardwalk cleanups in January of 2014, and for the past year we've been providing services under Clean Streets Initiative. Available for questions.
Excellent, thank you. Not seeing Mr. Steele, Mr. Bonnet.
He's coming.
Okay. I knew he would appear. You got it.
Sorry, son. I'll talk to you later. If you could list a series of things that you guys do, think you should be doing. Like, for example, people call you. I was talking to somebody right now. People call you. They see a homeless person, see some activity they don't like, and they call LAPD, right?
Yes, sir.
But they might really need to be calling like the mental health department, or LA Fire, or some other group. And so my question is, how do we extrapolate things that are really part of their core mission? Mental health is the core mission of the department. Mm-hmm. It's not your core mission,
right?
And so we have a disconnect, or we have I don't know how to say this. We're out of sync, right? And so you guys who went to the academy and did all your training and did all your preparation are now asked to be social workers, you're asked to be healthcare workers, you're asked to be mental health care workers, a whole range of things that you're asked to do that could be part of your mission, but it doesn't seem to me that that's what it needs to be today. Yeah. Right? So what are those things that we could extrapolate out? Maybe they belong to LAFD. I'm impressed in a kind of disappointed way that we don't have a community of healthcare providers in any of the hearings yet, Chairman. That we don't have healthcare providers here yet, and I just think that there's an incredible need when we have such a large community, a significant part of the homeless community diagnosed with mental health or substance abuse or dual diagnosis. I just don't think of that as your work, and I don't think that you, when you guys are at the academy, are thinking this is the work that I'm doing. It seems something that the training for that takes place someplace else. And so I just want to see if you guys got a list of things that you guys do that maybe you could extrapolate that maybe you shouldn't be doing, and that we should be lining up, whether it's the park rangers at MacArthur Park, right? Because there may be some activity at MacArthur Park, or in any park.
Yeah, yes, sir.
Where somebody says, well, look, I saw this over here, and, I showed up, and our little league's supposed to show up, and here's this encampment to call LAPD when they could call park rangers. They show up someplace for camping in the Royal, and they should be calling someone else, and they're calling you. And so maybe if you could tell me the list of things that you guys shouldn't be doing and somebody else should, and let's start there.
And I think that you've kind of identified a number of them already. And what I will say is, police officers inherently feel that they're problem solvers. So when somebody calls, they want to try and solve that problem at that time. And maybe in the beginning, in the initial stages, we would try and do referrals. But then you have the multiple calls for service issues where they keep calling, it's not getting done. So the other departments that are involved in their role in addressing the need that person may have, albeit staffing levels or funding, that's what it comes down to. LAPD becomes the default for addressing those things, because we're out there and they can call 911 and we're going to come and investigate to see what's occurring.
Last part you were saying.
So it would become the default for the services.
Default. Right.
Yes, sir. Yes, sir.
It seems to me that some of the problems, to get you, we call 911. Is that how we get you? Right.
Yes, sir.
But if I see somebody drunk or substance abuse problems, I could call 911 and you guys will respond. But there's not an office of alcohol and substance abuse. Right. I don't get them on 911.
Right.
If I see someone talking to themselves going down the street and then decide to relieve themselves right in the middle of the sidewalk or something, I could call 911 and your response, but I don't get mental health. Right? There's not a number. I couldn't tell you what the number is for mental health. I don't think it's available. And I don't think that we necessarily even have the laws that would permit them to do some of the stuff that I think they need to do. So, any other circumstances that you guys encounter where you think, wait a minute, why are we doing this?
I think all the social service issues of society that are out there on the street, that involve where people are living on the streets today, whether it's financial hardship, emotional hardship with mental health, with mental illnesses, not able to get to the health care that they need, living on the streets, physical disabilities that we're being called for, and then subsequently then we'll call fire on those things as well. So there's a number of things that we get pulled into dealing with, because it has become a call for service. We're trying to do those things. I think what I've seen lately is that there is traction. There's things that are starting to happen. I think the more we can get multidisciplinary teams out on the streets, involved and engaged in these areas where we have this concentration of homelessness, we will hopefully see some better results that take the police away from those responsibilities.
I'm glad you mentioned that multidisciplinary. So, for example, we have reserves, right? And many of them come with other skills. And I was intrigued with the idea of the nurse practitioner, because I think that's an incredible, a PA or a physician's assistant nurse practitioners, I think they have an incredible role and capacity to help us out in this scenario. Is there a place in your organization where there could...
That's a great question, because I know we have a number of reserve officers who have, very unique specialties that could help in our engagement out on the streets. I know we have a number of doctors and nurses, as well as some social providers as well. So I would definitely want to look into that to see what our roster reflects in some of these specialties.
Where do you work?
In Central Bureau, downtown.
You're downtown, you Skid Row?
Yes, sir.
So, as I said, I'm struck by the fact that we have had very few healthcare professionals come here. Very few. What are your thoughts on this nurse practitioner, and what would be the role? What could they be doing downtown?
Yeah, I thought that was a great idea. And initially, when we were speaking to the ISO program, the ERTs, we talked about maybe having a EMT, a paramedic from one of the fire departments, paired up with our teams, walking the streets to kind of triage, address something that did not rise to the level maybe of an RA response, but if it wasn't treated, it would rise to that level where a rescue ambulance would have to respond. So I think any type of partnership like that would be very innovative strategy of addressing those things that are going on in the street.
Okay. Thank you. Mr. Bonner?
My I on? Here we go. Let me start with LAPD. I want to go back to sort of a question I asked the library department at the beginning. When the CAO's report came out about $100 million, there was the startling figure that $87 million of it is spent, and there have been constant refrains, basically at every hearing. If we had the ability to, or we had the will to direct LAPD to not take any phone calls from people who had issues about homelessness, and we told LAPD not to respond to homeless issues, does that give us $87 million to then reprogram into the general fund?
I don't think so. I don't see that that occur. The spending comes from the officer's time, whether it's the property or the person or the medical treatment. You look at, I think our LAPD burn rate is about $75 an hour, roughly. So some of these really bad cases that they're dealing with out there go 8 to 10 hours before they're resolved, they're done, they've disposed the call. So that's where those things start to add up considerably. So
what I'm trying to get to is, because I don't think it's possible to reprogram the $87 million. Right. So I'm trying to think through why, or explain why that isn't the case. If you weren't responding to those calls, it's not like those officers disappear. Those officers are still on the payroll. They're still responding to other calls. Often an officer, there's radio calls that aren't responded to promptly because officers are assigned to something else. Right. So the only way to get rid of that $87 million expense is to lay off officers to create $87 million we can then spend. I just thought that was important to point out because that gets thrown out a lot. And would that it were easy enough that we could just tell the CAO move $87 million from here to here to come up with the resources.
Yes.
We'd have that recommendation already if it were that easy. Yeah. You mentioned the pilot project with the Mayor's Innovation Fund. When do we think we'll see that expanded into Venice and other areas?
Well, the fund, the grant we received was for 1 year. I think I'd like to report back to you within those 90 days and give you some results and some metrics on what's occurring. I try and remain very reserved on it, but it's beyond our expectations already, the impact that they've had. The ability to have those 2 ERT workers with our officers and have access through the CES to get people into different portals of their needs is tremendous. It's tremendous.
When is that 90 days up?
Well, we just started in the last. This is our fourth week. Our fourth week now.
Okay, and so you'll be reporting both to Budget and Finance and to this committee?
Yes, sir.
Okay, great. Also curious about mental health training in general. Do you have any idea offhand? I know it's sort of. I didn't tell you I was going to ask this in advance. You to come with the figures. Oh. Any idea how many officers have taken part in the training this year?
For this year, the report I received, this is a combination of outside and internal, because we do have outside agencies who come to the training for 36 hours. We were somewhere in the realm of 500 officers. I think of those 500, there's 375 that were from LAPD.
And similar to my question to LAFD about data which could show where the hot spots are for their calls, where they're helping transport folks who are homeless. Are those officers just from all over the place, heavily weighted so that you have greater numbers of them from who are suffering from mental illness?
Yeah, when the initial training started, we put priority on the officers from Skid Row first, but now it has expanded to all the different divisions. And because we've had turnover in Skid Row with our officers, we're having to resend officers for that training.
So I want to push past Skid Row, though. I know it's where your field of expertise is, but there's not just one Skid Row anymore.
No, definitely not.
There are many in the city of LA. Ms. Martinez showed us photos of one in Mine, Mr. Buscaino and San Pedro. I mean, every council member can tell you about their own Skid Rows. And I'm just wondering if we know how many of the officers assigned to those areas have been given the proper mental health training.
I can get you the numbers from our MAU team, and I can send it to your office. So it has a breakdown by division, if that'll help. So I can get that to you.
That would be useful. I appreciate that. And then a question for Steve at Sanitation. You talked about the cleanups that you do, and you also talked about the sewage from RVs, either leakage or delivered, as you know. Are there places, or is there a way to expand the number of places and dispose of their waste for free?
Well, as you may know, we had a rash of RV releases a number of years ago, and in order to address the need for the homeless to dump someplace, we opened up a site at the Hyperion treatment plant. Currently, I can go back to our management and see what the feasibility would be to open up additional.
What sort of infrastructure does that require?
Essentially, what it requires is a location where we can plug into the sewer, where it's a safe location to dump, where there's wash down, where there's staff there to monitor who comes in and comes out. What we don't want is someone coming in with hazardous materials and dumping there, of course.
Right.
Yeah.
Okay. But so there is a possibility that we could do it in more than just Hyperion.
We can explore that.
Okay. All right. Thank you. Thank you, Mr. Chair.
Thank you so much. A quick question, and I think this is for the both of you. So I got information that there is a unit, a special unit, LAPD personnel that works with sanitation on cleaning up encampment.
Cleanups. So many times that takes the form of the SLO, the senior lead office assigned to us.
So part of the discussion during this week has been, 11, has been the expansion of arrest powers for police officers that encounter forth. And one concern that came up during that time was a police officer's encounters an encampment, the person doesn't break it down themselves, they have to wait for sanitation to get there. What would a scenario look like where so if I get stopped in my car and I'm riding dirty, I don't get arrested, the officer calls a tow truck car. Is it feasible to create a scenario where sanitation could work like that?
11, and so we're going to be exploring all the avenues.
Okay. You have any comment on that, Commander?
As far as the tow truck idea?
Yeah.
Yeah, that would be a great idea. But I don't know if they have the availability to have all those trucks come out at those times. But we, like Steve said, we are working on a structured protocol on how to deal with both in the event after posting unattended and attended property, and then also the.
Excellent. Thank you all.
Okay. Thank you
so much. So we now have a representative from LASA to discuss ERTs and CES and their relationship to the various city departments. Hopefully you will help tie all this together. And one question I'll put to you just before you even start is, does LASA have a hotline or a number that departments can connect with?
Yes, so good afternoon, council members. My name is Grace Weltman. I'm the Director of Policy and Planning for the Los Angeles Homeless Services Authority. So yes, to your question, we do have a line that people do call. I don't have it memorized, but people do call that number, and we actually have emergency response team members that do answer that call, the phone line. And so it operates, but it's not a 24-hour phone number, meaning someone's not there live answering the phone 24 hours, but we have the capacity to offer hours outside of 9 to 5. We do get a lot. There was questions about, and I do want to start off. Well, I appreciate this discussion we do at LASA, because we're now having this discussion about how the city interacts, basically not just with homeless services, but the entire housing and supportive services system, which is basically Councilman Bond and you talked about. But in terms of, we work very closely with 211. My department actually has been conducting a review of all the outreach efforts that have been going across the county, mapping out what's going on. And what we're seeing is that you have into the system, and 211 may be one of those pieces. But for the city of LA, as you've from the different departments, ERT and LASA is a consistent theme. And I think these issues around outreach and engagement and role clarity are things that we are also looking at in response to this. But back to the phone calls, we definitely do receive quite a bit of phone calls and emails from your offices, and we engage around that. And oftentimes when there has been maybe 211 has gotten involved and we've gotten some agencies, or 211 has referred it to agency, there's no housing. Oftentimes LASA is pulled in and we'll work extra hours to see what we can do to help someone that's in crisis need. So I think the issue about this system, in how we work with the different agencies within the city, you've heard the different ways in which LASA is connecting. So there is an issue around how we link and coordinate to the broader system of the coordinated entry system, meaning the housing, the supportive services system. LASA is usually that entry point into that system for the city. So we are looking at how we can better coordinate those efforts, and definitely around the needs. Our ERT workers are generalists out there. They have a broad understanding of what services are available. So we'll often go out there and say, oh, okay, it looks like we need to partner with DMH. This is a constant thing in Skid Row and DHS around health services. Sometimes it's working like what we're doing with LAPD. And in some instances, when we're doing the cleanups with Bureau of Sanitation, we might go out there 3 or 4 times, and then, okay, we need to get DMH out there. So there's a lot of that coordination. We do need to continue strengthening what we do with fire in particular. I think the nurse practitioner program is something that we're very much, we've heard about, but also we know that the Department of Health Services are looking at this. We've been talking to health systems. So one of the things that we're seeing increasing is hospital systems looking to expand recuperative care beds and having beds available so that when we find people on the streets that we can get them they get into a hospital, or we can divert them into these other opportunities. So we're trying to work those out. So even around health, around HIPAA, we've been looking at those systems about data sharing. And one of the things that we think is a benefit to as we have this discussion about the coordinated entry system, is that it's tied to our HMIS system. So we do have things that we want to launch in terms of coordinating the data and the outreach. The other piece that I did want to talk about in terms of how LASA is also working with the city is we have been, through El Nino and a lot of our outreach efforts, we've been actually mapping out encampments at a real-time level. So we're not just waiting for the homeless count to come around. We're actually sending our teams out and mapping out some of these high-risk areas, and we've worked closely with Sheriff, and we're going to be working with LAPD more, and we want to work with the fire department to really identify, not only in the riverbeds, we have pretty much the LA River mapped out already, but we know that there are other places in Councilman Bonin's area that we probably need to look at. So these are all ways that we are working, but I think overall, the frustration that maybe people are having, particular city agencies, is that we don't have enough crisis housing, enough rapid rehousing to really get people permanently off the street. So that's something in terms of the CES system is really valuable. So once there is a contact to us, we can navigate with the coordinated entry system and really plug people into the housing and supportive services system. But as we build up more housing, I think you'll see more relief on the streets. So we just, applaud the efforts of the council in terms of looking at this systemic issue. And the last piece I do want to say, actually there will be one more last piece, but the last piece around this is we're always looking to coordinate better, and one of the things we're identifying as we've expanded outreach, we've seen also an increase of outreach teams with DMH and DHS, and then even at the community level. So we're working to coordinate these outreach efforts so that we can maximize and leverage the resources that we need. And we're also trying to approach each of your council offices to be involved in that discussion. And we do want to thank you for the support that you have demonstrated. And getting through 5611, LASA did submit our application to HUD early yesterday, and we submitted an application for $110 million, which is the largest ask we've had for HUD. We've asked from HUD, so we're hoping that as resources hopefully will be granted that award, we'll be able to offset some of the challenges, a lot of the challenges we're having on the streets.
Mr. Cedillo? Mr. Councilmember Bonin?
Thank you. Thanks for your response. It was a good response, but I think in response to Mr. Harris Dawson's question about the hotline, at least from my experience, I think you made the picture sound rosier than it is, and I want a more candid assessment because I think we really need to resource LASA better. I think LASA does a great job with the very limited resources it has. I mean, the emergency response teams, while the number is expanding and they're being deployed differently now, and I applaud that, it's not like they're really emergency response teams for the most part. You know, it's not like someone can call, and you said not 24/7, but even in my experience when I've called in the past and said, here's someone I've seen in distress, it's not like someone, you know, often until the recent redeployment, they were coming from downtown. By the time they got to the west side, with traffic, whatever, it's hours later. So they're not real emergency response teams. What sort of resources would we and the county need to put in so that LASA actually had a 24/7 emergency response service, so that if I have a constituent in Venice who gets home from work as a bartender at 2:30 in the morning and finds that there's someone asleep in their carport who may be inebriated or in distress or whatever, someone who needs assistance, that there's someone that LASA can dispatch as opposed to having to call LAPD. Because right now, LAPD is who everybody calls when they discover someone who's homeless who needs help, and that's really not where we want the first call to be. What would it take to get there?
And I will say that we do need more resources. I'm
Yeah.
not going to say
Yeah.
that we have adequate. We're expanding. Definitely, I think outreach teams that are decentralized and available regionally, which we've been trying to map out based on need, but also the ability to have some people answer phones and really be able to respond live to that. That is a capacity we don't have 24/7, and we do know that first responders are asking us to play that role, and that's something we don't have. You know, perhaps a call center or linking more with 211, and instead of saying, okay, we're going to call LASA and giving that, and also having the capacity to work with the coordinated entry system so that we can also work with them, because there are some outreach efforts going on, but I think for LASA itself, we do need that capacity if that is where the council wants to go. So
I assume you've been participating in or monitoring the county summit discussions pretty
Yes.
closely. Is there, from your perspective, any hope that by the time the county and the city have their plans or strategies in late January?
I think we'll get significantly closer to that, and I will say I'm personally involved in the Outreach and Engagement Summit, so there is a need for more coordination, and there is a talk about and how we manage that. I think for the city, we're going to have a conversation about what that really means in terms of cost, but there is definitely movement in that area, and there's movements in several areas. Roles and responsibilities about first responders in relation to outreach and engagement staff. So there's that, but in terms of resources, there's definitely been a push that if we're going to do this, then there has to be more resources be put into this. But on the specifics around phones and being available 24/7, in our outreach assessment, our preliminary results are showing that we have, and this is a gap that we definitely have, and we're not sure that we would have to work with 211, but what we're finding is that people need to connect directly to an outreach team, and it's usually ER.
There are yawning gaps. And I really hope we get to, if not this, within the next year, a place where we have a system so that if someone sees someone sleeping on a sidewalk, they don't call LAPD. I want them to call 211 or LASA so that they can go out and be offered services, and if we've properly resourced the strategies we're coming up with, get them on a housing. Since you're here, and since you mentioned the supernova in the application, I want to ask about the different HUD guidelines and what is no longer being requested for funding in terms of transitional housing, domestic violence shelter beds, all that stuff. If you could describe what is being lost by this, and I'm not blaming LASA because I understand what the HUD formula is.
Okay.
If you can explain what's being lost and what we can do to prevent 2,000 people from not being thrown out onto the streets.
At a high level, so there was about 2,000 transitional housing beds that were reallocated. We did submit a proposal that in dollars in new projects that are rapid rehousing and permanent housing, and that number is about 1,800 beds, just so you're aware. But what we're doing right now is looking at the resources that we have. There are different funding sources that that we're trying to identify. So projects that have been reallocated, we are having individual discussions with those agencies that manage those projects. We are working with them to see how they can be either transitioned into some providing crisis housing, or what other funding sources we can use to help maybe what we don't want to lose are the sites and the beds. So those conversations are happening based on their end date. But what we're looking at is DHS has already indicated that they might have resources on the health side to utilize the beds that might from these sites to transition into some of the recuperative care beds that they have. We're working with DMH to also look at what they can provide in terms of funding these. And we're also having conversations with other folks. I know that the district attorney, there's some conversations with the district attorney around our domestic violence programs. We are also looking at our rapid rehousing dollars that could potentially be used for crisis housing. So we're looking at all of this, but we're also talking to each of the sites and the programs individually. Is this going to fit your model? How can we help you? But we're not abandoning these programs. We're really trying to work with them. And if our goal is to get them to transition into some other model or that fits, and I think crisis housing would be something that we're definitely the first area that we're looking at and what we can do with the health system. But for those that might be displaced, we also will be working on transition into other programs or facilities. We do, for instance, we are aware that maybe some of the transitional housing veteran programs are impacted. We're already having conversations with the Veterans Administration and our veterans folks to see what we can do to get them in a different place so that we don't lose those beds.
I mean, I'm worried if the program has to repurpose itself to match the available funding, that a lot of the folks who qualified for that program might no longer qualify for however it's repurposed.
And those are conversations, again, we need to have with folks. We're looking at the family pots of dollars we're getting from the county because we have several transitional housing family programs that were impacted. So we will continue to report back to all of you how that is coming along. So
when do those existing programs run out of money, or is it various times?
It's various times. So we have 2 that's ending in December, and then we have some that are, it's primarily January and February and March.
That's soon.
Yeah, that's soon. So we're having conversations today and working with them individually, but we're not leaving them because, again, those beds are important. Even though we are gaining, if we get awarded more rapid rehousing and permanent housing beds, we do. Thank you.
Thank you. Mr. Cedillo, any questions for Lhasa? Okay. Thank you very much. Appreciate it. That was supposed to be the last department to comment, but since I temporarily have the gavel, I'd just like to ask CAO to come up for just a second. Thank you. Good afternoon. Sorry to put you on the spot, but there was just a little follow-up from a couple of the office on, since you're sort of quarterback for us on a lot of this stuff. One, I wanted to see if the CAO was with LASA on the conversation I was just having about the maybe lost, and thinking about for those programs that aren't repurposed, whether or not there's going to be
in the short, medium, and long term. So as we look to help mitigate some of the issues that are happening.
Okay. Earlier, I asked LAFD about the flexible housing subsidy program and ways to take fire department super users. LAFD wasn't aware of any conversations with the county about us buying into that. I know Mark Trotz and Mitch Katz have certainly offered to allow us to do that. I'm desperately hoping that you folks will tell me that there have been conversations between CAO and the county about that.
Yes, as a matter of fact, Trina Anzagar working with Housing for Health, and so we have been engaged in multiple meetings on that. So in addition to
here earlier as well.
Great, thank you very much. And has the office been dealing or talking at all with the folks in Santa Barbara about the safe parking program to understand how that could be a model?
Yes, as a matter of fact, we do have a staff member here who has been speaking with them plan.
Excellent. And final question is about the $100 million, and as I've been asking a few of the folks who've come up, there's such an expectation that a lot of that can be reprogrammed. The more I think about it, I'm pessimistic about how much can be reprogrammed, but is as we look to fulfill the $100 commitment that Mr. Wesson and I and a number of us made on the steps of this earlier in the year, potentially transferable, in addition to us having to look under couch cushions and reprogram from savings and hit.
Currently spending money, and there may be some efficiencies that are available as well. And
great. Okay. Mr. Cedillo, any questions for CAO? Okay. Thanks very much. Appreciate it. We will now go to public comment on item number 1. We have 6 speakers. Joanna, the handwriting's a little bit difficult. Looks like Bamba, followed by General Jeff, followed by General Dagon.
To go ahead.
Thank you very much. General Jeff.
Thank you, committee. General Jeff, Skid Row. The motion was to how could the city improve its interactions with individuals experiencing homelessness. Obviously, would be to start the Skid Row Neighborhood Council. It would even, with the heightened interest on homelessness citywide, it would even make sense to have the Skid Row Neighborhood Council. It would also be in the best interest of this committee to start their own homeless committees, and then engage with the city. Also, too, here's a thought. Think with me. And the GM of the homelessness department would be equivalent to the homeless czar, but with less profit. That's a start.
Thank you. General Dagon, followed by Pete White.
General Dogon. I'm a civil rights organizer with LA Can. I'm also the point man on our community watch team, the PD, and Skid Row residents for about the last 10 years. And I was here Tuesday at the homeless, for homelessness. Apparently, that's not being communicated to LAPD. We had a captain, Captain Org was sitting here that day, and I made reference to him, because it's funny how, the next day, Central Division came out with full enforcement. They came out with the horses, they came out with the bicycles, and they came out with SCI, and they went from block to block writing tickets, and we got it all documented, all tickets written on the 18th, which was the next day after, right? And so, and then another thing is you got the I don't care who you try to say you're gonna do outreach with, you cannot do outreach with LAPD. LAPD has already blown up the spots. Sanitation department, they even look like a police. You know what I'm saying?
Thank you. Thank you. Time is up. Pete White, followed by John Walsh, Antonio Ramirez, and Mr. Spindler.
1 minute is a problem. So I'm Pete White with the LA Community Action Network. Bonding is going to be like speed dating. You said, what can we do to make sure people don't get thrown out? Stop criminalization. Stop criminalization today. It's interesting that a spokesman for Mike Fear had this to say to the LA Times, that homeless people could be ticketed, fined, and or arrested and charged with misdemeanor offenses. In direct opposite of what we were talking about here in City Council. 2 things. CES, the Coordinated Entry System, I think you guys should ask more questions. The Coordinated Entry System right now produces 200 units per year. In Skid Row, we need 5,000 units. It's going to take 25 years to produce those 5,000 units. And so we can't just run around with these acronyms and not ask deeper questions. And then finally, first steps, 3 immediate things. I'll submit it in writing. This speed, 1 minute, is impossible. It's not really public comment.
Thank you. Mr. Walsh.
John Walsh, blogging at HollywoodHighlands.org, or J. Walsh Confidential, tweeting at Hollywood Dems, and saying hello to anybody listening on council phone. I agree with what you say, but what this vote for yes, but to really strengthen it, it's not going to mean anything unless the mayor declares a state of emergency. And the reason the mayor will not declare a state of emergency is because if he does, it will destroy the chances of getting the Olympics. And he's more interested in the $1 billion from the Olympics than he is on blacks, browns, or anybody except his own goddamn ass.
Ms. Ramirez, followed by Mr. Spindler.
What has been difficult as a homeless person is that there is no storage outside of Skid Row, and that is a cesspool. We need a laundry room, bathroom and showers, meal area where there's a microwave, a coffee pot, and kitchen supplies, a TV with military channel and Turner Classic Movies. Also, what you're also confronted with a homeless population is MRSA, staph, bed bugs, scabies, meningitis, encephalitis, legionnaires, kissing diseases, toxic loud noise, theft, vandalism, sleep disturbances every night and day, violence, gang stalking, trash debris, and filth, urine, feces, vomit, and all sorts of gang-banging markers. That's what you're confronted with every night and day. Again, these are mostly in bathrooms, music center, Grand Park, all homeless areas and shelters. And again, these comes from the wetbacks, gangbangers, junkies, pimps, and brawlers. Thank you very much.
Go. Justice denied. 1 fucking minute to speak at a meeting. It's despicable. That's a suppression of free speech. I was in one of your guest rooms over at your jail over there Tuesday through Wednesday morning when I was detained 13 and a half hours. They sweep these homeless people up and they throw them into custody because they're homeless. That's the only reason they do that. The other reason you have so much homelessness is because you're redeveloping the areas where they are. So you displace them, then your Jew developers go in and buy the land and build your big fucking hotels and get your money. It's bullshit. You're taking people and you're classifying homelessness as a criminal act. The only criminal act is this city for causing homelessness. And your bankers you do business with causing homelessness. We need more than 1 fucking minute to talk on top of it.
Okay, that concludes public comment. It's the recommendation of our chair that we continue this item and also give some instruction to the various departments. For the departments who are with us today, we would ask that they please provide council a supplemental budget request for homelessness-related issues to be incorporated into the strategic plan, and that would be needed by Monday, December 14th of this year. CAO and CLA could communicate that to those departments. It would be much appreciated. The other request is there may be some relevant departments that did not present to us today who also should be offered this opportunity. For instance, Department of Transportation or General Services, not to mention HSID. So perhaps we could ask CAO's office if they could help us to make sure that those other departments are invited to provide a budget request too. And if we could please provide these instructions to any departments that should be considered. So that'll be the direction, and with that, this meeting is adjourned. Happy birthday, Rachel.